Hi, everyone. I'm Kate Hanneman. I'm a cardiac cardiologist at the University of Toronto and Vice Chair of Research in the Department of Medical Imaging. It's my pleasure to be here today.
Hi, I'm David Playford. I'm a cardiologist with a specialist imaging background in echocardiography particularly. I'm the Professor and Chair of Cardiology at the University of Notre Dame here in Western Australia.
And really, today it's our pleasure to be here to talk a little bit about our recent AHA statement on value creation through artificial intelligence and cardiovascular imaging. Of course, on behalf of the entire writing group and with support of the AHA, it was really, such a wonderful but long process to see this through to completion. And we're so happy to see this published. And so really we wanted to just provide some highlights on, kind of the process that we went through and also the key points of our paper. So David, maybe I can turn it over to you and you can talk a little bit about where we started and, how we got to the initial writing.
Yeah, look, thank you very much, and it was a real pleasure working with this esteemed group of people in for this paper. And I think one of the things that came out really strongly is that the uptake of artificial intelligence in other forms, not in medicine, but like in other walks of life, all of us are familiar with it, and realistically, we're actually very familiar with AI without necessarily even realizing that it's part of our daily lives. But within medicine, it's been quite slow to be adopted. And there's a lot of reasons for that. If we take into account, for example, that technology adoption is really like an S-shaped curve. And it starts off at the beginning of technology being like this, that in medicine, it's really only a research tool, at least in the early years. And there's a few enthusiasts who kind of enjoy this type of thing who get involved, but not really from a clinical point of view. And there's really no clinical adoption to start with. And everyone's very skeptical, and there's no real feeling that there's any gaining of efficiency in looking after patients or any value really in artificial intelligence as a modality. So really nothing happens, and it spends this long period of being relatively dormant without really being seen, I suppose, in the greater cardiology realm. But then it reaches this period where the methodologies improve, accuracy improves, and it starts to be able to be integrated with real live clinical systems that improve the way in which we can practice. And then when we start to see efficiency gains and improve workflow, then this is the beginning of a transformation. And that transformation is really this widespread adoption curves that certainly in my view, and I think we at the writing panel all agreed that we're at the beginning of this. We really want to see a way in which we can develop this in a very scientific and very measured way, so that we can really give good quality AI to the cardiology community.
I agree completely, and I think this kind of unique perspective where we actually think about we have all these tools that have been published and are really in the research fair. But when you actually look at what we're using in our clinical practice on a day-to-day, there's this huge gap, and really thinking about, well, how do we actually bridge that? And I think that was kind of one of the guiding principles. And, rather than doing another kind of, more review where we talk about the different tools and, maybe even do a bit of a forward look, we really wanted to have this whole lens to look at that in terms of value. So like, what are we trying to achieve for our patients, for our payers, for our healthcare systems, and for us as imagers, and really, really trying to use that to try to frame the whole discussion. So I think one of the reasons it seems like this has really resonated with people, and I'm so delighted to see that, of course, is this unique perspective, which of course we can apply elsewhere in healthcare and elsewhere as we think about how do we apply AI. And so that was really interesting, I think, for all of us, even in the writing group, to kind of really think about these things more explicitly. And I completely agree with David. I think, really what ultimately all of us who work in this space and who are interested in developing AI tools, and of course, the developers and the vendors, really want to see these actually being used ultimately to improve patient care, to improve our throughput, or, whatever it is, and decrease costs perhaps. So, so many different perspectives to think about.
So can I ask you, Kate, what in terms of the modalities and how it's sort of relevant to different types of modalities, did you have any sort of thoughts in relation to the value chain and also about the and something about like how it's relevant to imaging itself?
Yeah, thanks, David. That's such a great question. So, my clinical practice, I do a lot of cardiac MR and cardiac CT, and my research also encompasses cardiac PET. And so, from my perspective, when I'm thinking about the value that we might have, in clinical practice in our reading rooms, really, I think we have so much pressure. We have more patients, we have higher volumes, and, we need to get through our cases, in some cases, I think faster. And so for me, one of the, key value adds is trying to reduce those kind of repetitive tasks. And so one of the things where we actually are seeing AI being useful for us is in terms of, contouring and cardiac MRI, for example, just as an example, removing that kind of time-consuming repetitive task. And AI obviously has actually been integrated in many of our post-processing tools there. And so I think of that as, obviously time is money in most cases, particularly for us as physicians and imagers. And so, that's one of the value lenses that we look at. But I love this equation, and just to acknowledge, this was adapted from something Dr. Jeff Rubin, who is, of course, also a writing group member and vice chair of actually the writing group here, had published previously and really had thinking about value equations from these different perspectives, so society and clinicians and financial. And I think, often we think of it, the cost of things as, being quote unquote value, but there's so many other lenses to this, even the environmental impact when we think about what imaging tests we're going to use, how much energy does it require, and so forth. So that was kind of my perspective. But I'm interested to hear, David, what you think, where you think the value is in your clinical practice.
Yeah, you see, I think I think you're right. I totally agree. But I think that this, if you take that very first equation, this societal equation, we've already got demonstrated effectiveness of a lot of cardiac imaging. We've got a lot of effectiveness of cardiac interventions of a fantastic armamentarium of drug therapies that really do save lives and make a fundamental difference to the outcomes of multiple different diseases. And it's really based on extremely solid randomized clinical trial evidence. And so in order to demonstrate that AI is enhancing that, we've got to show value, and we have to show that we're not in any way eroding effectiveness. I think that's really, really important, that we don't take away from what we've gained already from all the good evidence base, and that we're adding to it rather than, we don't want to be, this doesn't want to be like a cost neutral equation. It's got to be superior overall. And when we add the actual cost, not just of development, but if this becomes, each AI product becomes a commercial enterprise where it gets sold, that the cost of that's got to be low, because if the cost is high, all we're doing is adding to overall healthcare costs. We're not actually, we're not using the effectiveness equation the way it should be in a societal realm. And I think we can translate that through clinicians, and hospitals are always going to look at these things. Hospitals are very financially driven because of the rising healthcare costs, and so they really need to show that the cost is low relative to the revenue that they would gain as a result of it. So I think this is actually really, really important, Kate. I think it's a great formula, as you said. I want to tease you out on something though, because you mentioned before about MRI, and I totally agree with you about the improvements that we have potentially with introducing AI at almost every level across there. I'm also thinking, I'm an echocardiography person, so I'm thinking about in the value goes all the way across, and to me, I'm thinking about the initial thought, should this person actually have a cardiac imaging test to start with? And if they are, then which test is the right test for them? Can we use AI for that? Then we've got if you're going to send them for the test, what tools could be useful in integrating data from other types of patient repository information, things in the electronic medical record, for example. What other information do we need in terms of informing the generation of that image, like you with MRI or CT or one of those other, one of the other modalities that we talked about in this paper, what types of things can actually be automated that will improve the quality of the acquisition, the acquisition protocols. What do we need to do in terms of the pixel recognition, the actual going from the actual generation of the image through to the diagnosis at the other end? Can we use different types of data, measurement data? Can we use report data? Like there's all these large language model possibilities. It goes on and on. And I think we can talk about it for hours. But then at the end of the day, what we have to do is translate this to actual changes of patient management and informing better decision processes for our colleagues.
Yeah.
So I suppose I've kind of accidentally summarized a couple of slides here, but what I wanted to really do is ask you, what your thoughts are of how the future is going to unfold in that broad range of things.
I think you have touched on so many of the key points there, and you summarized it so succinctly. So one, thank you for that. And I just to kind of reiterate one of the key points that I think is maybe obvious most on this kind of figure, which is one of the figures from our paper, is you touched on that AI has the potential really to transform how we provide cardiovascular imaging all the way across the patient's journey. And that starts even before they come to us in our imaging department. And so, I just want to really highlight that. Like, I think sometimes we kind of get this narrow lens where we think about, well, AI can help us in terms of, maybe post-processing. And that's the example I gave before, but it is so much more broad than that. And we really do have to take that zoomed out first view to really think about the value. The other key point that you made, and I think this is just so important to be explicit about, is we have to take all of the perspectives into consideration. There are multiple stakeholders. And so, we talked a lot about cost, and that's important. That's important from thinking about how much these tools are going to actually cost from a financial point of view to purchase and to deploy in our healthcare systems. But also, the cost in terms of what did it cost to develop them? Where is that money coming from? Is this sustainable? And then I think we have to think about the value beyond financial cost. And so, you touched on, does this improve patient care? Does this help us make a diagnosis faster? So do we avoid additional downstream testing? What are the implications for that? And so I really think as imagers and as clinicians, we really need to think about defining those metrics. What are the outcomes that will tell us that these AI tools were successful when we integrate them into clinical practice? Because without that framework, without these metrics, without targets, it's very difficult, as you said, to maybe justify the upfront costs. And so for me, I really think it's important to take that, these very unique perspectives. And one of the ones we talk about in the paper, and we haven't touched on, I really think it's so important, is the patient perspective. And there's been a lot of literature on how do patients feel about AI being used, on their imaging or in decision-making algorithms. How do we disclose that to them? All obviously, and I really, again, think this is a point that you made but it's worth reiterating is, we do not want to deploy these if they are going to take away from patient care, take away from, negatively impact patient outcomes. And so that always has to be a guiding principle for us, of course, as physicians. And so, really for me, I think it's so important to think about the entire patient journey. And Tessa Cook, who is one of our writing group members and is so fantastic, was really helpful for me when we were having some earlier conversations. I don't know if you remember, David, really talking about, the pixel-based and the non-pixel-based applications. And I think because, I'm an imager, I often thought about the pixel-based applications. So again, those segmenting tools and so forth, but there's so much beyond that. And Dr. Cook has done such great work in this space in terms of thinking about, as you said, we even, using AI to determine, does the patient need a cardiac imaging test? How can we reduce low value imaging? And this can tie in with some of our, imaging wisely campaigns and so forth, and ties into, environmental sustainability. Now we know, we generate a lot of greenhouse gases and use a lot of energy to create these images and to store the data. And we really have to think judiciously about that. So that's kind of my perspective. But, really, I think we just have to think very holistically about this from all the angles and really from the whole patient journey. So
yeah, no, I totally agree with you. And I think there's you've brought up another set of really important points. One is from the patient point of view, and I agree with you. The patient ultimately is in control here. This is their heart that's being imaged. It's their data, and what happens with that, they really need to be involved. And I actually see this as a massive opportunity because for patients to see what is going on in their heart, as we all know as cardiac imagers, you show a patient their images, it makes a huge difference to their understanding of disease and their willingness to be part of the journey as well. So they're more likely to be compliant, etc., with medical therapy. But I think also if we use the tools well, then these new AI tools well, then that can actually enable us as humans to spend more time actually sitting in front of our patients and having real conversations. And I think that's incredibly important. So I think that does give us a number of opportunities, but there's also some risks. And I wanted to just spend a moment on the one of the things that has been talked about a lot, and I think this is something that we mentioned in the paper is about explaining and the explainability of the AI itself. We can't have black box AI that shows absolutely no information about how it came up with its determination. By the nature of it, a lot of AI is black box, but there's an explainability element that can come out of that, and I think it's a really important step to show what is the output that the AI has used. So to display forward on the results screen to say, here's the AI determination, but here's the data that was used in order to bring up that determination, and this is these are some steps that the AI has used to do that, and that in some ways is almost, as humans, we look at something and we say, well, we just know, we look at the image, we've done it so many times, we just know what it shows. And sometimes it's even hard to explain that. Whereas if we subject the AI to a requirement to understand what it's done and why it's done what it has, that actually will go a long way to getting patients on the journey, saying, don't just trust me. It's like, here's the data, let me show it to you. And so I think that's powerful. What do you think about that, Kate?
Absolutely. And I think we've seen such a shift in, even the AI literature over the past, 1 to 2 years in terms of really moving from that very black box where, you got an answer and you had no idea how it came about to much more explainable AI. And I think, part of that shift has been, obviously the explosion in generative AI, which I just want to highlight it. When we started this, writing group, that was barely a thing. And really we had to kind of integrate that after. And so, I think some of these, as AI evolves, which is obviously evolving very quickly, even in the kind of more narrow healthcare and cardiac imaging sphere, I think this is incredibly important. And, you highlighted that it's important to the patients. Absolutely. It's also important to imagers. And, there's lots of people that I work with, and presumably that you work with, that, that are skeptical that AI is actually going to help us. And so I think that explainability aspect is important really from many stakeholder perspectives. And I think it ties in also to, if we understand how the output came about, that will obviously help us in terms of using the data. So being comfortable understanding, it was some error, also potentially, tying into model drift, and then ongoing evaluation of how the model is performing. These are not typically going to be like plug and play for many years. We really have to think about that oversight and that longitudinal plan. And I think we absolutely have to have those plans in place before we, have wide scale deployment and integration. And most of the healthcare systems are taking a fairly cautious approach in that regard, it seems, at least in the Canadian healthcare system. But interested to hear from you, how things might differ in Australia.
No, I think it's much the same. I think Canada and Australia have actually quite similar health systems. I think the US is a little different, and probably the goals are the same, and what we're trying to achieve is unified, but the method of doing it's probably a little different in different countries. I think this slide is something we talked about a bit, but one I think probably. Just before we finish up, we do need to say that, and I think you did sort of touch on this earlier on, that this is not just about images. Like, images is a vital part of this, but there's we've got the across the spectrum which we were discussing earlier, but even if it's just the image, the imaging process itself, we don't want to just focus on the acquisition of the images and a pixel level AI, even though that's incredibly important, it's essential, and we can't do this without it. I think that there's also information that can come from the richer other information that's not just image-based. So, patient demographics, information about their medical history, if that's accessible. And I think sharing that information is going to be a really key thing. And we did touch briefly in the paper on privacy and how we need to get a more robust way of dealing with things. We obviously have to respect privacy above all else, but at the same time, we must share certain information in order to be physically able to provide the care we need. So we've got to somehow balance those two almost impossible differences. And then also, I think the outcomes, we don't want to really necessarily go directly from an image to a diagnosis, because if we do that with no measurements and no data and no explainability in between, then it's really quite opaque. And we don't, an opaque outcome is not something that either images, patients, or payers will particularly want. So, to me, I think we need to have steps along each pathway. And so, from the image recognition, we need to move on to having some form of output. Now, the output, could be measurements. And in some circumstances, that's the right thing to do. And other times, it's like, diagnostic criteria or whatever it is. But then from that, you can have a second set of AI that picks up those outputs, including, measurement data or whatever, and then turns that into a diagnosis or a prognosis. So yeah, I think it's kind of similar to what you were saying before, that it's along the entire value chain. So I've talked enough, but is there anything else that I haven't covered that you think we need to cover to discuss this?
David, that was perfect. You really summarized it. And I just want to reiterate, absolutely. I mean, I think we're talking about this from cardiac imaging, but we need to integrate all of those other pieces of information. And, you touched on this before. It's like, that's something we do when we're interpreting imaging. We of course, we look at the demographics, and we often look at the lab values, and we look at the clinical indication. And so, AI that will add value will integrate all of those inputs, the inputs that, it is pulling from the electronic health record, of course, as we become essentially completely digital. And so absolutely, I really think we have to think about pulling in all those other pieces. And the only other last piece, I want to highlight is, you talking about having different steps, and absolutely just want to highlight for everyone, likely we'll have different tools that will add value at different steps along the way. As David said, maybe helping us to do the segmentation, or even earlier, acquire the images faster, and so forth. And it was at a recent presentation that touched on some of this, and, had this very futuristic perspective, is that, we won't even look at images anymore. We'll go from the raw data, so, case space and MRI, and AI will output the diagnosis or output the prognosis. And obviously that is a very futuristic perspective. I'll just highlight that. But, I really think, using AI and augmenting our skills as physicians and imagers is really where we're going to, have the biggest, bang for our buck, to put it less. Like, I don't think this is going to replace us. And we've really, kind of moved from that discourse. But I just wanted to highlight that I think these tools are going to add value as we interact with patients and interact with the images. And I think that's a really important, that these are kind of tools that we will use, and hopefully we will, be better when we use them, rather than just shunning them. So I think that we've touched on the key points, and thanks, David. Anything, last comments?
I was just going to say, you've been a fantastic chair of this writing group, and I hope to see you in many more of this type of publication. It's been an absolute pleasure working with you, and thank you for such a fantastic document. Well done.
Thanks, David. It was a pleasure to work with you. And again, I just want to thank all of the writing group members. It was a lovely group, and we had a wonderful time, and it was a pleasure to work with everyone. Thanks.
Thank you.